So you're having trouble with your Pro-Select Platinum or your Pro-Select 3 with your handpiece. And what's happening is the water is just shooting straight out of it and it's not creating a fine mist and the tip is not vibrating. Let's look at a couple of things that you can do in the office to see if you can't get some resolution before you have to call us here at customer service. First is when the tip is not securely tightened, it will actually, the water will just shoot out. And it will also make a humming noise, a squeaking noise. The first thing we want to do is make sure that we take this wrench and tighten it 1/4 turn. This will ensure that the tip is on, but we don't want to over tighten the tip. We just want to make sure that it's tight enough. So 1/4 turn should be plenty. Now we're going to start, and now we have tip vibration. We have a mist and we have tip vibration. That's the first thing you can do. If that still doesn't work for your handpiece, what you can try doing is shutting the unit off and switching the ends of the unit. This will determine if it's the handpiece cable itself. This is the handpiece cable. So now we're going to try switching the ends and see if that clears up the problem. In this instance it did, and we now have vibration again. So before we isolate if it's the handpiece tip or the handpiece cable, we want to make sure that we run through these checks ourselves in the office to make certain that we can give them accurate information so we don't have to do this while you're on the phone with customer service. If for some reason that didn't work and we tightened the tip and we also made sure that the cord is securely plugged in, pushed all the way in, and also switched the ends and we still get no vibration, we would then go to seeing if it is the handpiece itself. In this instance, they're going to ask you to check the transducer. This is the area here where the tip is plugged in, actually screwed onto the handpiece. If this area becomes over tightened or becomes loose, the transducer itself will move and rock back and forth. Now there'll always be a little bit of movement. That helps the crystals to create the vibration to actually make the unit work itself to remove calculus or tartar. So we are going to check the transducer and make sure that it's securely lined up and that there's equal space on all sides. If this is moving too freely, we want to make sure that we tell customer service that this is moving too freely. It warrants the handpiece useless. So we're going to put this back on and we're going to move on. So now we're going to talk about, now that we've talked about the handpiece, we're going to make sure that the tip is tightened, the handpiece cable. If it wasn't working, we're going to switch the ends out. We're just going to reverse the plug and see if that helps. You also got additional handpiece cables with your unit when you purchased it. So now you may not have any water flow coming out of your tip. So what we'll ask you to do yourself first is to make certain that the tip itself, when we take the handpiece off, that the unit itself is getting water or enough water flow. So what we'll ask you to do is take this part of the handpiece cable out of the unit and put a cup, a rinse cup, underneath this and put your foot down on the foot pedal. Once we can determine if there is water coming out of this, we then know that the issue is now somewhere in the handpiece cable or it's in the tip. What we will have you do then is to take the tip off and try another tip first. There may be something lodged in the hole that usually comes out where the water comes out. So we'll ask you to take your air syringe and blow it through the tip itself and to determine if it is something that's caught there. If it's not that, we'll then ask you, once we determine that the water is coming to the unit, we'll have you put the handpiece cable back on and take the handpiece off. So we can determine if there is water coming out of the handpiece itself. So we'll ask you to step on the foot pedal and see if there is water coming out of the cable. If there's no water coming out of the cable, we know that there may be, for whatever reason, some medication, whether it's chlorhexidine or fluoride crystallized somewhere in this cable, and we can determine that the water flow is stopped here. So we'll ask you first if there's no water flow to your handpiece, take the cable off, put your foot on the foot pedal, hold a cup underneath where the handpiece cable goes, and make certain that there's water coming through the unit. We'll then ask you to put the handpiece cable back on the unit, but take the handpiece off and see if there's water coming through the handpiece. If there is water coming back through, we're then going to ask you to put the handpiece back on the cable and determine if there's any water. If there's still no water, it's something that's in the tip. We'll ask you to take the tip off, blow air through it to try to see if we can clear it that way. If you have an issue where you have continuation of water, water is dripping out of the handpiece itself, the first thing we're going to ask you to do is check your foot pedal to make sure nothing is lodging it and pushing it down even slightly. That will have the water continue to flow out of the handpiece and drip out of the handpiece. So we'll ask you to check your foot pedal and then take that foot pedal out and check it with another foot pedal if possible to see if it's this foot pedal itself or if it's something that's in there. If for whatever reason it does get lodged and it's pressing down on it, then it will have the water continue to flow out of the handpiece. We can then take it from there. That's if you have no water or water coming out without you depressing on the foot pedal. We also want to make certain that if there is no water coming out of the handpiece itself, we want to make sure that the water is actually turned up. So on your flow rate here, it will say flow rate. You will press increase to make sure there's a high level of water coming out, and then run through the previous steps to make certain that there is enough water. So those are some basic things to check if you do not have water flow or if water flow is coming out too much, to check that. You're not getting any mist from your handpiece. The first thing we need to check is this handpiece itself, is this tip a good tip? In other words, what I'm asking you is, on your wrench that you received with your unit, you're then going to be able to notice that there's a little hole that's underneath where you would tighten the tip. We want to make certain that when we put the tip through the hole, we can see it through the other side. If we can't see it through the other side, it means that the water may not be hitting the tip. It is vibrating, but the water is not hitting the tip to create that mist. So we would ask you to call us here at DenMat to then be able to order a new set of tips or try another tip to see if that's a little bit longer. Sometimes we get calls that the irrigating handpiece itself isn't heating up. So there's a couple of troubleshooting techniques that we're going to ask you to do before you call us here at customer service. That first issue is to make certain that when we put it on irrigator mode, that we wait a full 45 seconds in order for it to give us one solid long beep to let us know that this handpiece is now ready and warmed and we're able to do our subgingival irrigation. So we do have to have that waiting period. Now, if for any reason we continue to use this for an entire quadrant, at some point this handpiece, the fluid that's coming out of it, whether it's medication or water or fluoride, the medication that's coming out will then return back to room temperature again. If you want to stop this from happening, what you'll need to do is wait until the handpiece has fully been heated up by waiting that 45 seconds, and then begin to irrigate your quadrant. I would start with 2 or 3 teeth, and that will keep that solution nice and warm. That's the solid long beep that you'll hear. Now, I would then, after I do 2 or 3 teeth, you can shut the irrigator mode off and then back on again, which will reset and help that whole heating element to start that process all over again, if that's something that you choose to do. And that's if your irrigating handpiece is not warming up. Also, if it's an older handpiece, we want to take a look at the age of that handpiece. It may be that the heating element, if it's 5 or 7 or 10 years old, we may want to replace that irrigating handpiece because the heating element itself may be burned out in the handpiece. So that would be another area that we could check once we've gone through all of this, if it is something with the irrigating handpiece not warming up. Sometimes you'll have issues with your handpiece pulsating or making an intermittent beeping. And what we would ask you to do is run through the steps for the handpiece. In the previous video that's entitled Handpiece Not Vibrating or Water Not Misting, we would run through those issues. But there's a few other things that we can check. We would then want to check to make sure that where the tip actually screws onto the handpiece, that matting or that threading is nicely cleaned. So we would ask you to take an alcohol wipe or a 2x2 with some alcohol in it and wipe off the threads just to make sure that these are clean and that we're getting a good contact with the tip. We're then going to ask you to put the tip back on. Make sure that we finger tighten it down and that we give it 1/4 turn with the wrench, just to make sure that it's tight. This will happen also too, if the tip isn't tight, it will squeak and make that squeaking noise. So what we would have to do is, after it comes out of the autoclave or sterilization, we would just have to tighten it down with that 1/4 turn and make sure that this tip is securely tightened onto the handpiece itself. We would then ask you, after you've wiped the threads, to then try it again to see if that is fixing the problem, after you've changed out the cord and determined that that's what the issue is. So here's the instance where we're now going to move on to if the unit itself will not power up. If the unit itself will not power up, there is an area, and I will turn this unit around so that you can see. There is an area in the back where there is a fuse. Here is where the fuse is located. So what you're going to do is take a screwdriver and you're going to be able to unscrew it, and the fuse will be included in this black piece here. Once the fuse has been removed, you can take the fuse out, careful not to touch the glass on it so that no residue from your fingers or oil gets on that glass, but you'll be able to read what type of fuse it is. And those fuses are sold at local hardware stores and Home Depots, Lowe's, things like that. They're pretty easy to find. You can just go and replace the fuse out. That is if there's no power coming to the unit at all, which means in that instance, it should read when you turn the unit on that it's on power selection. It'll give you the level, what bottle you're on, whether or not you're on scaler or irrigator. Also, I've had offices call in and say that their handpiece wasn't working, and it was simply that this got switched to irrigator mode. When that happens, the handpiece will not scale. So we want to make sure that this is always on scaler mode when we're scaling and irrigator mode when we're irrigating out periodontal pockets, making certain that that's not an issue. But if you're not getting any power, we want to check and make sure the power source is okay. So sometimes what you can do is unplug it and plug it back into a different wall unit to make sure it's not that outlet to begin with. And if that still doesn't work, we're then going to move on to check the fuse. Once the fuse has been replaced, you should be able to turn this on and power up the unit. Plug it in and power up the unit. That's if we're not getting any of that. So we're now going to move to talk a little bit about what happens if the unit itself is leaking. Sometimes you will get water leakage underneath the unit, and that's something that we need to be aware of. So that there's a couple of reasons why that can happen. Number one, that can happen if this plug that goes into the unit here, if this plug isn't securely pushed in, the water can actually leak out of the unit. If the handpiece is not completely secure onto the handpiece cable, it can leak out of the handpiece. So the first thing we would ask you to do is to put some paper toweling underneath the unit to determine where that water is coming from, and then decide what we can do from that point. If it is coming out and we've checked to make sure that these two are securely fastened and the water is coming out of somewhere else, that would be an issue that you would need to make sure you contact customer service, and you would then have to send your unit in. But just so you know, the unit will work, and this electronics has all been lifted and raised internally, so it will not sit in water itself. So you don't have to worry about getting shocked or any types of those things, but I wouldn't let it go for too long before you send this unit in so that we can repair that water leak. Sometimes it can happen if the unit's been dropped. Sometimes it can happen if it was pushed or bumped into something. It's not fragile, but it's something that's where we would see that water coming out of the unit itself. So you're having issues and nothing happens when you push on the foot pedal. What the first thing we would do is ask you to make sure that the unit is turned on, that it's plugged into an adequate switch, and that there's a light that's present, this green light here. There's a light that's present letting you know that you are receiving power to the unit itself. We'll ask you to take the foot pedal and take a look to see inside to make sure that everything is functioning properly. So we want to make sure when we're looking at the foot pedal that we're able to move the bottles back and forth. We're able to increase or decrease the power. So we're able to see if the foot pedal itself is working. Sometimes, again, these get kicked because they are on the floor, or sometimes they can be stepped on too many times, and that can be a part that needs to be replaced. So we're going to ask you to go through the foot pedal to see what's exactly wrong with it. If you have other units in the office, what we would request is that you go to those units and that you find out if there is a handpiece that's not working, is that the only handpiece that's not working, or is it all of the handpieces that you have in the office? You will have multiple handpieces that you've bought with your unit itself, and we'll ask you to do the same thing with the foot pedal as well. So if this foot pedal for this unit isn't working, they are interchangeable. If you have other foot pedals that look like this, if you have other foot pedals in the office, to swap out to see if it's this specific foot pedal or if it's the unit itself. So now we've determined if the handpiece is continuing to leak. We've checked the foot pedal to make sure that there's nothing impeding it underneath here. There's no material that's caught that's preventing it from being undepressed completely. We've checked to make sure all of these areas are clean here to make sure that there's no issues there. But now what we're going to ask you to do, if that water continues to flow, we're going to ask you to turn the unit around and unplug the foot pedal itself from the unit to see if that stops the water from leaking. So we'll ask you to unplug the foot pedal with the gray unit or with the gray plug. We'll ask you to unplug it and see if the water stops running out of the handpiece. We'll then ask you to plug it back in to see if that resolved the problem. If it didn't resolve the problem, then your unit is going to need to come in for repair. At first, you can try just ordering a new foot pedal to see if that resolves it, or you can send it in and contact us here at DenMat Customer Service. So there's no water coming out. We've now checked to make certain that it's not the tip, it's not the handpiece cable, the water is still not coming out. The first thing we would ask you to do is to try a different bottle. The way that we can do that is just by selecting bottle on this unit to switch the bottle to see if we get water flow that way. If it's still not coming out of that bottle, we would ask you to switch to the third bottle to see if we get water or solution coming out of that port. It's faster if you just take this plug off of the front and run a cup underneath it to be able to determine which bottle is stuck or clogged. But let's take a look at what we find out if the bottle is clogged. One of the ways that we can do that is by shutting the unit off and then taking one of these bottles out. And there's some areas that I'm going to ask you to look at. So we're now going to take out this stem or the lid to the bottle, and we're going to be able to take off this piece down here at the bottom. And down here at the bottom, there is a screen that's on this, which looks just like your screen that's on your kitchen faucet. We will ask you to look at it and also use your air syringe to clean this area out and blow some air through it. Sometimes medication can be crystallized at the bottom, and that's what's preventing it from coming out. So we would take that piece off and we would put this back in to the bottle, and to determine if that's what the issue is, turn the unit back on, make sure that you are on this bottle, and does the water flow freely through. If it does, we need to make sure that we clean this piece out that we spoke of with the screen, using a toothbrush or a small brush to clean the area out, and use the air water syringe to blow any debris out that may be stuck or lodged here. So now we're going to determine if the ports itself have been plugged. And one of the ways that we can do that is patients will tell us while we're scaling that they're tasting medication. If you happen to have loaded in here chlorhexidine and fluoride, they may tell you that they're tasting it, or you may see foam in the patient's mouth while you're using it that looks as though it's medication. What we want to determine is if these ports are actually mixing. One of the ways that we can do that is by unscrewing the bottle itself to see if and put just water on here and then run through each bottle. This will happen sometimes at this tip here. Medication can get clogged in the tip of the bottle. And we want to make certain that that's been cleaned out and that that's not what the issue is. So we would make sure that we would try different bottles that came with your unit, and also clean this port underneath here. There's a little hole that you can then tip the unit and be able to clean out that hole to make sure nothing is lodged or stuck there. That will also help us to determine if it's something that's with the unit or with the bottle itself. Remember, the most important thing is make certain that you run through your scaler each evening if you've used a lot of medication that day, to run through clear water through all of your ports just by switching the bottle to the bottle to the bottle to the bottle, and run for about 5 seconds in each bottle, clear water through the handpiece, through the cable, to make certain that we clean out any of that unused medication that may be in the line or also stuck here at the port, to prevent that problem from happening. This should be completed each evening. This small service only takes about 15 to 20 seconds to run 5 seconds of water through each bottle. Also, with the bottles, we want to make sure that these bottles stay securely fastened to the unit. So we want to make sure when we put these on, they're just interlocking. So we're just going to put these on and be able to find where those grooves are and then slide it and lock it into place. We don't want to over tighten this, and because we don't want to crack these bottles or crack the seal. Sometimes when that happens, it can also render the scaler useless, and we would have to send you out new bottles. There again, you also got extra bottles with your unit. You had 3 that go on and 3 for backup. So we're going to ask you to swap out the bottle to see if that is what the issue is before we have you call in. So we're looking at the handpiece, the foot pedal, and the unit itself, if for any of those reasons those issues are affecting your scaling. If the cord is moved and we can get it to vibrate and move back and it stops vibrating, we know it's just a simple replacement of the cord. The whole unit itself doesn't have to come back in. But what we are going to request that you do, if you haven't found what you needed on this video today, we will ask you to email us here at customer service at denmat.com. We would ask you to include the serial number of the product, and you'll find the serial number on this product specifically on the back where it says serial number. So there will be an area here where it will say serial number. We will ask for the serial number. We also want to know what unit type it is. If it looks like this and it's stainless steel, it is the Pro-Select Platinum. And if the scaler is white, it is the Pro-Select 3. So we would like to know which one it is, and also the issue that you're having and what you've done to swap out these issues so that we don't ask you to run through them again, so that we know exactly what it is. And we will ask you to include your phone number and account number so that we can determine where your office is, and we will get back to you within a 24-hour period to take care of your issues. If you have any other questions, you can always email us again at customerservice@denmat.com. Thanks for watching.